But I'm going to go through most of what's inside the accommodation process, and I'm happy to stop at any time and talk about anything that comes up, any questions that we have. So the first thing I want to talk about, just like undue burden and undue hardship, I want to clarify the difference between accommodation and modification, because they have two different functions, or they have two different purposes. And a lot of people use these interchangeably, but they're not really interchangeable terms. And I'm going to walk through the interactive process and then some of the special treatment issues that we run into. Because it's really important that we know how to talk about those issues when they come up. And then Kat is going to walk through some of the accommodation examples and some of the things that the accommodation fund can pay for, because we want to just continue to support everybody, know that that fund's available. And like I said, we'll have time for QA. So when you're looking at accommodation versus modification, essentially, not to bury the lead here, the difference is between participation and discrimination. So in accommodation, you'll notice that the definition of reasonable accommodation is a modification or adjustment to a program, service, activity, job, or the work environment that will enable an individual with a disability to participate in the program, service, activity, application process, or perform essential functions. It's about the participation in that program or service or the employment process. It's about their ability to participate in that single process. That's accommodation. Modification, on the other hand, is a modification to your policies, practices, and procedures when the modifications are necessary. Excuse me, folks join in here. When the modifications are necessary to avoid discrimination. So when you look at these two together, again, modification being this, can they participate in the application process or perform essential functions, or in Title II, can they participate in a program, service, or activity? That's participation. Modification is more focused on systematic issues, hiring and recruiting practices, harassment, non-discrimination. And in Title II, it's places of public accommodation, policies, laws, barrier removal programs. It's what the organization sets as its policies, initiatives, their foundation, their mission, vision, and values. Do those conflict with the ADA? So again, participation is a single instant, discrimination is systematic. Modification is systematic, which ultimately can result in discrimination if the intent is not to remove barriers. Also, when we're talking about providing accommodations, I always found that there were two levels to this. The first level being trust and compliance, which is where everybody starts. First, we need to build trust with our employees, and we need to make sure that we're complying with the law. So doing that, taking a proactive approach, keeping your communication clear, responding in a timely way, and providing those resources, that's trust and compliance, being available and complying with the federal law. The focus on improvement track, which is a separate track, but it could follow trust and compliance. When we're at a point where we're documenting accessibility, we're training frontline staff about their responsibilities, and we're reviewing the accommodations for effectiveness and maintaining those accommodations. That's the difference between trust and compliance. That's getting started and building that relationship, and improvement is improving the process and turning it into innovation. So there's two stages here. We go through the interactive process. I think that this is one of the main things that's so super important to me in accommodations, and it may all be for you as well. And I really can't wait until we get other presentations in here, because I really feel bad. Like every month it's just me, but we're starting to get more folks in. So, but this has always been very, very important to me, because a lot of folks think that if you don't follow the policy, you don't, that the accommodation doesn't have to be granted, but that is not the case whatsoever. When the accommodation or the nexus is obvious, we have a responsibility to help our employees. And so it's like, yes, we could have this policy. We have this policy that we do need to follow, and that's what the DOJ wants. But when the accommodation is obvious and the person needs help, we don't need to ask them, hey, if you want to fill out this policy, I can help you. In Jacksonville, I had 25 employees, and half of them, at least 50% of our employee population, were representatives from the disability community. We had very cross disability representation in our office. It was intentional because we were managing a lot of lawsuits, and we needed to understand where the need was. And in those cases, even when I had employees, a lot of these folks were my friends for years, 10, 12, 13 years, they still would not ask for the accommodation because they didn't want to fill out the policy. They didn't want to go through it. I don't know, they don't want to be embarrassed. And they shouldn't have to feel that way. But the bottom line is, from a compliance standpoint, employees do not have to complete an accommodation policy or form. If the accommodation is obvious, they can use plain English to request an accommodation. Hey, this desk it doesn't work for me. I can't reach my mouse. That's obvious. If you're talking to someone who uses a wheelchair, there's no reason for them to have to fill out an accommodation form. Now, ultimately, we may have to fill out the paperwork just for records, but they don't have to go fill out a form and go through this long, really, tenuous and sometimes embarrassing process. They can use plain English, and the EEOC has affirmed that. A lot of supervisors also think that for an employee to have an approved accommodation, they have to use the accommodation process. But again, an employee doesn't even have to use the word a reasonable accommodation or the word ADA. It's not required to begin the interactive process. The reason why is, again, if we told everyone, if you need an accommodation, you got to fill out this form, we're creating this huge backlog of paperwork. And in a lot of cases, especially particularly when it's obvious, all we're doing is just burying the person in bureaucracy. And so, in red tape, excuse me. When someone uses plain English, hey, I may need some help, and the nexus is obvious, the EOC we're not going to support us running folks through policies. They're going to look for, were we responsive to the needs of our employees, and were we responsive to plain English requests, or requests that didn't use the word ADA? Are we supporting our employees regardless? I know I could have said that in a sentence or two, but I can't tell you how many times how many supervisors I've worked with where it's like, if someone needs an accommodation, they just need to submit their paperwork. They don't always have to. That's not always true. And it's a very dangerous thing, because I've done surveys in the past in different organizations. And by and large, what I found in these surveys is that the disparity between what an employee understands our level of compliance is, and what a supervisor understands our level of compliance is typically about 40% difference. We can argue that 40%, 20% of that belongs to the supervisor, 20% belongs to the employer, and they're just not meeting in the middle. But even if we settle in the middle, there's still a 20% disparity. And so a lot of times, employees may not know what supervisors think that they know, and vice versa. Supervisors may not know their responsibilities. So that's why it's important to have those policies in place. Oh, yes, ma'am. Thank you, Jennifer. So this was of a survey that I did years ago. Essentially, I like to put these primary keys in my survey because it helps me delineate the difference. And so what we asked in this survey was, are you supervision or are you staff? And we asked them, where are you at on this model? Where are you at in accommodations and all that good stuff? And this particular survey was for ADA and digital accessibility and language access. And so the first that first chart where it shows with PD, without PD, that's with position description, without position description, which is a really poorly worded, but this is so old, I'm just pulling one of my old graphics. But essentially it was supervisor versus non-supervisor. And in the ADA, they were about 20% off. And in language access, it was more like 60 or 70% off. And so I settled in the middle and said, it's about a 40% average, a disparity between what employees think and what supervisors think in terms of how far along we are in compliance. And so I wanted to include that because to me, it was like, it just kind of spoke to me like, okay, so we know that folks aren't getting the message, and supervisors really don't know what their responsibilities are. So that's a blind spot, pardon the term, because if supervisors, if they don't know, we have to give them the resources. And if they don't know, then it's kind of on the organization. So we need to make sure that we're training our supervisors, training our frontline employees as to what their responsibilities and roles are. So I just wanted to share that piece there. So we kick off the interactive process, and the first stage is we're gathering information. And, you have to think about where are you going to get information from for an accommodation. The first obvious place is going to be the employee. When the nexus is obvious, we don't have to request additional information. I did just want to pause for a second and talk about this additional information and medical documentation thing. And I'm certainly would love after the presentation, or now it's fine with me if it's not disruptive for everybody else. I'd love to have this debate. But I think that I have heard over and over, because, my job is to put together training, put together resources, and kind of be a sidekick for whenever anyone here needs me. And I'm getting pulled into a lot of accommodation requests. And what I'm hearing is we don't ask for additional medical information. Well, I love the spirit of that. I love that we're not making it burdensome for someone to request an accommodation, and that we're not going to put them through this huge process when it's super obvious. But there are situations where additional information is needed. I want to just make sure I throw that out there. I don't know if that's a statewide policy. I haven't got to that yet, but I keep hearing it in every agency. And I don't 100% understand it, because a lot of the accommodation requests that I've had to process in the past absolutely require additional information. And so, there's just situations where we do vet more comprehensively. Consider this, for example, when someone wants to request a disabled parking permit, outside of saying that they need a permit, what else do they have to do? They have to get a doctor's note. The doctor has to say, yes, they can't walk more than 200 feet. The doctor has verified this. Look at how someone qualifies for paratransit. If everyone could just take a doctor's note and go into paratransit and say, I want to ride paratransit, every single person would, because it's $70 a ride. It's essentially, if you're not a person who needs it, it's a free ride, because it costs $70 to paratransit. It costs nothing to the rider. So there's a clear financial incentive to the individual requesting the accommodation. And that's not what we're trying to do here. And so in that situation, folks like our paratransit system and the one in Florida, they use an Easter Seals process where they walk folks through the entire. I used to sit on the board. I've listened to this process, and I've had to sit on the appeals of these things. So I've gone through this many times. That not only do they just ask for a doctor's note, they take them through an evaluation. Let's walk. Let's find out how far you can walk. How much difficulty do you have breathing? It's a whole process. It takes 2 hours. In the entire time, they're monitoring. Okay, awesome. Oh, thank you, Rachel. They're monitoring the entire time, being helpful the entire time, helping the person along the way. But there are fail safes built into that process to ensure that there is no fraud committed. So thank you, Rachel, for clarifying that. So I totally love the idea of no additional medical information, but the point of, I wanted to just kind of put that out there, because I keep hearing it and I haven't figured out, are we just not asking for it at all? Next source of information, supervisor, right? Supervisor is going to have a pretty good idea of what this person is struggling with, or what the barriers they're facing. If they can't use their desk, it's pretty obvious we need to find a desk that works. But if the supervisor, if it's not clear to them, just engage the employee and find out, what is it that you're having trouble with? What type of accommodation do you think would be helpful for you to perform the essential functions of your job? Another piece here, at disability advocacy groups and law, I know I'm talking to friends here and we're all colleagues. So I would say that, use caution, but, not all allies are created equally. But when you have identified an ally in the advocacy group, there's nothing wrong with calling them. You don't have to share medical information. You can just ask, hey, if I was facing this kind of barrier, what kind of accommodation may work for me? Healthcare professionals are another one. Oh, I'm sorry, use technical guidance. That's another tool that I have on the Access folder. Is we have a technical checklist as well that the folks can use. And like I said, I'm plugging all that stuff into the maturity model, into those accommodation spreadsheets. I'm really trying to anchor 3 or 4 of these sheets so that we all have this consistent place. And everyone here can add to this. This is everybody's sheet until I can get it turned into like a dashboard, a Google site. This is where I'm putting all the information. Please use it as you see fit. But going back to that documentation, I think that there are certain situations where it's 100% appropriate. I'll give you another example of this. So we had, and I'm just trying to be so careful because there's bills going through right now and I'm having to write a lot and I don't want to like use examples that I've used in private. I don't know, but I'll give you one that's just generic from Jacksonville. We had an individual who had been testing through the ranks in the fire department. And it wasn't really the fire department, but it was similar. If you get my hint, there's only 3 or 4 of those types of agencies, right? But they're testing up through this thing. And throughout the entire time, they're given more time on their test, okay? Now, they get to this point where they're taking the paramedic exam. Again, firefighters, police, emergency operations, a lot of them can take paramedic as well. So I'm just trying to be super generic, even though it's like 15 states away. But each test, he's given more time. He gets to the paramedic test, he asks for more time. Okay, now we have a different issue, okay? Because if the more time that you're asking for is in regards to a test where you're supposed to be able to demonstrate your ability to save someone's life, well, in that case, I think we're going to need a little bit more medical documentation to understand if this is even possible. Because just saying, yeah, you've had more time in the past, so you should have more time now. But the test is about life-saving procedures where their ability to recall information and conduct whatever that operation or task is immediately is what's being tested. So in that case, yeah, I mean, it doesn't mean that they can't do the job, but we need to understand a little bit more, because if we gave them more time and they pass the test, so it looks great, but then they go to save a life and they can't do it and they're pulling out a pamphlet and asking for more time, that's a huge problem for us. So we need to be realistic here about what we're giving folks and what it means, not just to us and our business needs, but the operation as well. So we gather information, but again, we only ask for what is necessary. I'm just advocating that we don't rule out digging into things that require more vetting, because I've always seen it like this. Our job is to protect the organization and to protect the community. We're here to find this place where they work together well. And we can't do that if we just give away the house, but we can't do that. And we can't protect the community if we're not actually following the ADA. We need to protect this process for people who need it. Doesn't mean that we have to guard the process. We don't always have to understand it. The system is not perfect and abuse will occur. But if we stick to the ADA process, the intent is that there is an equivalent level of access provided no matter what. So yeah, like I said, it's not perfect. But when we're looking at accommodation options, another thing that comes up is this apprehension to try things that we don't understand. And so I put these cards up here just to kind of walk through that, because these are all little things that I learned along the way. One time we had someone who needed to work from home, 10 years ago, before people worked from home. People did not like this idea. And, internet 15, 12 years ago, it wasn't as fast, and it's just the infrastructure wasn't there. But this particular individual needed to do that for 4 weeks. And so, we finally just sat down and said, let's be open to new ideas, and let's understand that, just as the ADA says, these can be trial periods. Just because we grant an accommodation once does not mean that it's for life. We can set the accommodation for a trial period for 3 to 6 months, ensure that it's effective for the employee and the employer, and revisit it. And is this working for you? It's working for me. Our business needs are being met. You're able to do your job. Are you comfortable? Great, this works. If it doesn't work, we can try something else. Don't be afraid to consult medical professionals either. You don't have to tell people, hey, Tom asked for this, so can you tell me something? Why? Call a rehabilitation center and ask, hey, how are you doing adaptive gaming? How are you doing adaptive recreation? What are some of the resources that we can use inside of our agency to improve access for our employees who are doing very similar tasks, scheduling, coordinating, working with the public? Consult those medical professionals and other resources, and just ask them in general, what do you recommend? Technical guidance, I'm always going to lean on technical guidance. I built an AI bot that only has technical guidance loaded in its behaviors so that I literally only get the facts. I don't want anything subjective from the internet. Technical guidances are your guide. This is like our Bible in terms of what we do. Your technical guidance, if you document, hey, I referenced the ADA technical manual, I used this checklist, this is what it told me. I contacted the DOJ helpline, I contacted Ask Jan, any of those resources that are available, and this is what they said. What, even if we get it wrong, what can be said? Like I said, we're not ever going to be 100% accessible. We can work towards more accessibility and more compliance. We can get to that point over time through good faith and good intentions. Invite the employee to offer suggestions. I mean, it is their accommodation in their life and career, right? They're probably going to know. My daughter has apraxia. She's had apraxia since the day she was born. She couldn't talk until she was 4 at all. She knows exactly what she needs. If I ask her, what do you need, Alexa? She's going to say this, or I need you to let me think about my words for 5 minutes and I'll get back to you. I need to write it to you in an email, whatever. She knows what she needs. So don't be afraid to ask them what they need. Focusing on function. I love this slide. I had it in the Lunch and Learn because it's just so hilarious to me. It has nothing really to do with accommodation, but I just love the advantage that Rosie took. This is a picture from the 1980 Boston Marathon, and she is famous for starting the race, hopping on the bus, and then getting off the bus and crossing the finish line with police carrying her because she was so exhausted. And I always just thought that was hilarious because that would not be an accommodation. That's her just getting on the bus and not doing the race, not doing the essential part of it. So I'm going to focus on function, not advantage. Yes, as from an equity lens, that's obviously the direction that we want to go. We want to try to create more equitable solutions. And we do need to address some of the things that go well beyond compliance. But what I'm advocating right now is that we focus on function and make sure that we have our ADA principles and practices in line. Not to say no one does. I'm just trying to make sure I just put the very generic, streamlined information out, and folks can correct me. I'm open to it. I'm new here, So we've collected the information, and now we're implementing the accommodation, right? Something that I learned very early on is that if you don't install the equipment and maintain it, it just won't work. We had multiple places where we could not afford to put a ramp in, say like a stage at a library, or a stage at a I don't know, whatever, at a courthouse, or a jury bench, which is the main thing we got sued for back home $200 million later, because we didn't have accessible jury boxes. Let's say you put in a portable lift to accommodate the fact that we can't put a ramp in. Well, when it's time to use that lift, it needs to work. And I can tell you that this is not a lesson that I've even learned properly yet, because every single time I tried to use these lifts or any other tools, they never worked. Because if we're not using them regularly, if we're not changing the batteries, if we're not checking them, it's equipment, and it's not great equipment either. I mean, the truth is that a lot of these companies that offer these solutions, God love them. I mean, we've got to be so grateful that they're there. But these folks are doing it. A lot of these folks are in it for the right reasons. They don't have Google or Amazon money, so they're putting out products that are functional. And so we have to do a little bit of heavy lifting and make sure that we're supporting them by maintaining those accommodations, those ramps, those ergonomic desks, whatever it is. We need to make sure we're going around. If it's every 6 months, is this still working? Do I need to change the batteries? Do I need to plug this in? The TTY, how often does anyone check TTY anymore? So we need to make sure that once we install the equipment, we maintain it, we educate employees who have any crossover with this individual or interact with this equipment. They need to understand what the policy is, what their responsibilities are. Don't touch the equipment. It's just the same thing as like disability awareness. Don't hang on a person's wheelchair. Don't grab their cane. Don't do all these silly things that we all learn the first year of this work. It's the same thing with this equipment we installed for accommodations. If I put in a Zoom reader onto someone's desk, that's not for someone to lean on. That's for someone to read with. So it doesn't mean that we pick up the Zoom reader and play around with it. Hey man, you seen this? Look how cool this. No, that's someone's actual equipment. So we need to make sure that we're training people on that policy. They're not touching other people's auxiliary equipment, and then communicating what the expectations are of organization employees in regard to how they interact with the individual using that equipment. Not talking about their accommodation or disability, policy on the equipment and how to maintain it. So, and I kind of covered this twice, but I think that monitoring it is really important. I can sit here and say that we should be monitoring it, but I have to admit that beyond keeping my own little short record of accommodations, it's not something I had to keep like a binder on. I had 12 or 13 of my staff who had disabilities, but I knew them. I knew what they needed. I knew how often they needed it, and I had a very great working relationship with them. So I have to admit to you that I did not fill out a form every single time I provide an accommodation. However, I have seen the merit of doing it, having done it several times, identifying whether the accommodation is effective, and then identifying whether or not it may be effective for other people. You can only do that through monitoring the accommodation and learning what kind of innovations come from it. So, making sure it's effective for the employee, the organization, remembering again that equipment will not function forever and that policies are not always adhered to. So equipment breaks down and people don't follow the rules. And I know that everybody is surprised to hear that. So turning accommodation into innovation. And then we're going to jump to special treatments, and I'm going to wrap it up for Kat. Just very quickly, to me, accommodations are always like this huge opportunity. The way that I learned digital accessibility, my first exposure to it was like 12 years ago. And I'm like in the middle of all these lawsuits, and I'm working with all these commissions and councils, and everything's just happening and it's busy. And, I feel like we're getting stuff done. And one of my good friends, Dan, emails me and he's like, I just find it so hard to believe that you're $200 million into lawsuit stuff and you still send me flyers that aren't accessible. And, when I read this thing, I'm like, wow, I can't believe I did that either. The truth is, though, the flyer was terrible for anyone. The fact that he pointed it out, that I can't read this, most people didn't like the flyer, but didn't want to say anything to me because it wasn't really a functional flyer. It was like, here it is, here's what's happening. Well, we didn't take any time. We didn't put any care into it. So him pointing that out to me was an opportunity for us to kind of raise the level. What kind of information are we putting out? Are we using the templates of the organization? Are we using the best practices to create the document? And think about this. When documents are not accessible, just as an example, not only are they not accessible for individuals with disabilities, but they're also not read in the SEO of your website. So all of the customers that you have that you would like to find your program or service or office, they're not going to find this flyer ever because it doesn't have any actual hard coded information into it. It's just an image. I'm just saying it's an example. So when someone points out a barrier, look at it as an opportunity. Okay, what are we doing here? What can we do to improve this for this individual, which may very well improve it for all people? Embracing different perspectives, promoting inclusion, and sharing best practices. That's what we're here to do today in every meeting, and what I hope we all do as a team. But the ultimate goal is to get to a point where we're designing with all folks in mind. And you can't do that without their perspectives. And that's what I want to get to next year when we start talking about our communities of practice, community engagement, input. I love that stuff. It's not it's not the easiest work sometimes, but it's completely necessary. But we'll talk about that next in a few months. Unless folks vote a different way and want to do something different. But I think without any additional feedback, I'm just going to keep working on the model. We can shift as people need additional resources. Fine. I put that this resource too in the chat, and I'll get through the special treatment issues very quickly. So Kat has some time here. I'm about to wrap up. It's a very basic document, but it does create a record for us to kind of look back and say, here's when we approved it. Here's when we checked it. Is the equipment maintained? Have we written a policy? Is it working for the individual? We also have a record that we did it and we took the time to actually check up on the individual to document that what we've done. And we've demonstrated good faith in terms of just trying to make sure that we're supporting our employees and complying with the actual law. Okay, so when we talk about special treatment issues, I only wanted to bring this up because I feel like this one is like a double-edged sword where um, we're influenced when an employee says to us, "That's not fair. I don't get that," or we're afraid because we think that people will see it as special treatment, and in truth, some of them will. Um, as an example, right? So we'll talk about this with the Royal Mail Company. So it's the Royal Mail, right, of Royal Government in Oregon. They deliver all the Royal Mail to all the Royal Hangouts. 10% of their employees are administrative functions. 90% of their employees run the mail. The leave policy is that requests must be made 7 days in advance. And why is that? It makes total sense. I mean, if you're delivering mail, you have deadlines, you have to have folks kind of pushing. That request policy can make sense. I need 7 days. I got to be able to find somebody to run your route. Someone's got to run the Royal Mail. Well, in this fake case here, let's imagine that at the Royal Mail Company, Emma requests 5 days off with a doctor's note and an ADA accommodation. The request is not submitted within 7 days in advance as required by policy. And at least one colleague is aware of the request and upset because her request to take short notice vacation was denied in the previous week. She comes to the supervisor and says, "Hey, I wanted vacation last week, and now Emma's just going to take off for 7 days. What is this?" Well, let me remind you, the first thing I would remind the supervisors that the difference is this is an ADA accommodation request, but what can you say to this employee now to help, because this is just bad vibes. It's not their business, but you have to resolve it. You can talk at a high level about what the organization's obligations are in terms of all laws. We don't even have to be that specific in terms of ADA. What a reasonable accommodation request is, and if they're aware that this was even a reasonable accommodation request, what the interactive process is in general, broad strokes. Let me just educate you as to what all of these federal laws we must comply with, so that you can understand that you'll understand why I can't share with you beyond our broad policies here. So publishing those policies in employee handbooks, in an orientation materials, providing the notices as required by the ADA, which we've talked about in previous presentations. Those are all ways you can just point employees to kind of just mind your own business. Look, here's what the policies are. These are our responsibilities as an employer. Title 1, 2, 3, 6, 9. All of these are applicable to us. And just like you would not want me to discuss your business, I'm not going to discuss theirs. If you have a request, you can put one in too. You don't have to get into the weeds, and you don't have to be afraid to grant a request because someone is going to, "Oh, what about me?" It's not about you, and I'm not going to talk about it. Second request. So Sanjay requests a work from home schedule due to a mobility injury. Royal Mail grants a request. It's pretty obvious. He was injured. You don't need additional medical information. He clearly, he comes to work, talks to his supervisor, his leg's broken, whatever it is. It's obvious. We grant the request, but colleagues are saying, right, what's available for one employee should be available for all employees. If I could count the number of times I've heard people say this, I mean, it's like right when you get engaged in this stuff, everyone just kind of comes up and is like, hey, whoa. Especially employees who really don't get it. And we all know who they are when they're there. There's always some employee who's just like, if they get it, I get it. And it doesn't matter what you say. But the best thing to do is to advise again about the agency's policies, advise about policies regarding the hybrid work environment. Don't talk about the individual. Advise them about what types of schedules are available to them. Reaffirm the agency's commitment to its federal obligations, to the laws that it must be compliant to. And then again, direct them to the fact that it's our obligation to handle every request and every interaction on a case-by-case basis, and that I'm going to maintain confidentiality because I would do the same for you. And that's it. It's not our job to make sure that everyone understands, thinks is fair, or believes that they've been treated fairly. What our job is to make sure we actually treat people fairly. We can't control their perception. We can direct them to the policies and advise them that we would respect their confidentiality as well. So with that said, I'm going to kick it over to Kat, who is awesome. And she's going to talk about some accommodation examples and and Kat, all the great stuff you're doing.
Yeah, absolutely. So we've talked about accommodation examples in the past, but I just kind of want to touch base with them again, and remind people what accommodation examples are available, what we might be able to help with the accommodation fund, how to access that, and how I might be able to help you with that. So we've kind of divided the accommodations into different categories. Physical accommodations being a big one, and really the most obvious one, the one people think about the most frequently: automatic door openers, handrails, tactile signage. And I wanted to point out that tactile signage doesn't necessarily need to be just Braille. Not everybody who's blind or has low vision uses Braille or can read Braille. So tactile signage could be like in a conference room, a tactile map of where the tables are. So when the person entering the room knows where the tables are and it's easier for them to navigate. Also, the tactile sign could help people who have been in the conference room and moved tables around to put them back where they go. So the next time the person who has low vision or is blind goes into that conference room, the tables are in the same position and they know they know where they are and they know where to avoid them instead of the tables being moved around and then they run into a table. Can't be that comfortable, probably pretty embarrassing. So tactile signage could mean a lot of different things, besides just being a Braille sign. Modified workstations. So this helps. I feel like modified workstations help a lot of people and not just people with disabilities. I have a standing desk, super helpful for me. I didn't get it through an ADA accommodation, but I can see how people that need a standing desk might need it for an ADA accommodation. Vertical platform lifts, super great alternative to ramps in places that a ramp isn't feasible because of architecture, because of accessibility for the building, space-wise. Vertical platform lifts, they do need to be maintained, like Kevin was saying, but also they're a great alternative to helping people with mobility concerns getting in and out of buildings. And of course, ramps. And these also need to be maintained. How often they need to be maintained can be a bit different, but of course they still do. Sensory accommodations. So these are ones that we probably encounter more frequently with our requests than we do physical accommodations, such as screen readers, amplified phones, noise canceling technologies, ASL interpreters, and captioning services. These are going to be great options for helping with the ADA Accommodation Fund. We do help a lot with ASL interpreters, captioning services like CART, those types of language accessibility resources. We do a lot of help with that with the ADA Accommodation Fund. We do help with the amplified phones and screen readers. If somebody does need screen reading technology, finding out which one they have used in the past or have experience with. For those of you that have used screen readers or have experience with any of them, you know that they function differently between software, and if you've used one doesn't mean you necessarily know how to use a different one. Connecting with OIT would be a great option here to make sure that you are getting them a technology that is compatible with the state software and the state systems, and that OIT has been able to use, but also one that they're familiar with as well. Cognitive accommodations. A lot of these aren't going to be a funding issue, like extended time for testing, not necessarily need to be funded, which is wonderful. Accessible test materials, we can absolutely help with that if there is testing material that needs to be large print or braille, or we might be able to help with getting that testing material done in a way, in a format that is accessible for them. Software, definitely connect with OIT, make sure they're in the loop with that, make sure that you're working with them pretty closely to make sure that software is compatible with our state software for sure. So reasonable accommodation examples could look like a lot of different things. Doesn't necessarily need to be a funding issue. So if somebody says they need a reasonable accommodation, it doesn't necessarily mean it's going to cost the department any money or much money at all. Could look like, of course, modified equipment and devices, job restructuring, part-time or modified work schedules, if that's possible with their particular position. Providing readers or interpreters. We can use the ADA accommodation fund for this. So if funding is a concern, please reach out to me. Let's talk about it and see how the fund might be able to help support with that. And making the workplace accessible and usable by individuals with disabilities, that's going to be really those physical accommodations. If they are working in a building that has barriers for physical accommodations, reach out, find out how we can work around that. I feel like job restructuring could look like working from home if they need to, if there is time required in the building, but they can do their job from home. Having that job restructuring as working from home or having a more hybrid model could be a great alternative. I know of a case that the person was doing work in an office. They were doing office work. They have epilepsy and driving was really stressing them out. Driving to and from the office lights were causing them to have additional seizures. They simply restructured the job for a work from home. And she does her job from home just the same as she did it from the office. Cost us literally no money for the company to do. And she is much better health, much better mood, and she can still do her same job. So easy accommodation.
Can I just jump in real quick and just say,
Yeah.
I think that one important distinction about the job restructuring piece is that job restructuring and job carving are two separate things. So when we hear about job carving, which is essentially breaking up jobs, rebuilding them to fit individuals, job restructuring is identifying the essential functions and looking at unessential functions that don't necessarily belong to this job, but they have been there before, but aren't required to do the main functions of the job. So it's like a librarian who cannot can't open a door that weighs more than 5 pounds. One of her side jobs is to come in, open the doors in the morning, and then work the front desk. Well, if you got 50 librarians, does it have to be that librarian that opens the door at 8 o'clock in the morning, or could it be someone else? Could it be the janitor or the maintenance guy or the director? It doesn't matter. Does it have to be her, the person who can't open the 5-pound door? She has to open it. That's job restructuring. That's identifying the unessential functions and removing them and placing them in somewhere where they're more appropriate. Job carving is creating jobs that are more specific. And I just wanted to clarify that because a lot of people hear job carving out in the community and they get really nervous about then restructuring, and they are two different things. One is separating essential functions from unessential functions, and the other one is creating a job specifically for a person's ability. So they are two different schools of thought. Okay. How do you come to? Okay, that's actually, Kat, do you mind if I just answer that real quick? Because I actually meant to cover that on one of the slides. I meant to.
No, it's fine. Absolutely. Do you want to read the question for people that?
Yes. Yes, ma'am. it says here, how does it work when the employer manager doesn't agree with the types of accommodations suggested? How do you come to a solution that works for both parties? So I wanted to, one, talk about that relationship and how that determination is made. So the ADA gives preference to the individual requesting the accommodation. That means that if they say, I'd like an ASL interpreter, and you say, well, this company has 5 employees, we only make $4,000 a month, and so we can't afford an ASL interpreter. So now the employer has to find another accommodation that's just as effective, like VRI or VRS or whatever, Ubi Duo, I Speak cards, whatever the level is. But if the organization, if it's not an undue hardship, and if the accommodation allows the individual to do their job, the employee gets preference. But if the accommodation does not help the employee perform their essential functions or does not meet the business needs of the organization, the employer gets the final say. And on paper, the employer always gets the final say, but the employee gets preference. So it's a preference if it's not an undue burden. And if it's an employer who has to make the decision, they have to find what's most effective for both them and the person. But if all things are considered equal and cost is not a factor and essential functions can be conducted without a problem, the employee gets the preference. So ultimately, to answer your question, the employer makes the final decision. Just know that before you make that decision, what happened? Okay, the computer is going insane. So I'm going to just pass it back to Kat. But ow, I don't know what's happening with my computer. So I'm going to, Kat, go ahead. I think we covered it though. Yeah.
No, you're good. So why are accommodations important? They're important so everybody has equal access to programs, services, and activities regardless of disability. Promoting equality, making sure that everyone has the same opportunity to participate in programs and services provided in places of public accommodation. So, for example, a group of employees go to a conference, and 1 or 2 of those employees are deaf or hard of hearing, and they need a sign language interpreter to be able to access the same material that they're hearing coworkers. That is an accommodation to promote that equality of not equal access to the information. You would hate for them to say, oh, well, sorry, because you can't hear, you just have to sit here for 8 hours and stare at this person talking, but you don't get any of the information while your coworkers do. So it's providing that equality. But it can also offer economic benefits by opening doors for new customers and serving as a source of innovation and creativity. I know that Kevin and I talk a lot about accommodations turning into an innovation that all of us end up using. And it's so important that we see it as an innovation and we see it as not putting somebody ahead, but really giving them a little boost to be able to be where everybody else is. I used to work with the IDD individuals with intellectual and developmental disabilities pretty frequently. And the people that I talked with, they were so excited to have a job, and they were so excited to be able to be part of the workforce and to get money so they could go buy whatever they wanted to buy. They didn't have to depend on everybody else to be able to purchase things, and they wanted to be part of the workforce and interact with people on a daily basis. They just needed a little bit of extra support to do it. And seeing how excited somebody is to be able to join the workforce when they're in their 40s and have never been able to work before is literally the biggest gift, to be able to see somebody do that and see the excitement in their faces. And it's the reason that so many of us do this job, is to be able to help with that economic benefit for sure, but also see them really excited.
Yeah. I think, okay, I'm sorry, we had one more, but I think we kept this in. I think if everybody was at our lunch and learns though, I think that you've probably already heard this, but this is one of my favorite examples. I'm sorry, Kat, did you?
You should do this because it's your favorite.
Okay. But this is, so I don't know if folks know, but Braille was actually invented by a soldier in Napoleon's army in the very, very late 17th century and early 18th century and very early 19th century. Essentially what they were doing was they were trying to come up with a messaging system so that they could send messages across the battlefield without anyone knowing. They didn't want to light fires. They didn't want to do it during the daytime. So they created this wax paper where they raised the characters on the paper so that the soldiers on the other side of the battlefield could run their fingers across it and read the message from Napoleon's army. But ultimately, Napoleon didn't find it very useful. He had a very active, it was a very mobile army. So he was moving so fast, if you study this guy, that he almost didn't even need this. But Louis Braille found this night writing system a couple of years when he came back to, a couple of years later, and he developed it. He identified that yes, the raised characters are great. It would be better if we had a more streamlined system because running your fingers across letters isn't always effective. So he came up with the tactile dots. But this was an innovation that was built to give an organization an advantage that led to an accommodation. And there's so many other situations where it's worked in the reverse way, where an accommodation turns into innovation, like bendy straws or Siri, AI behavior models. All of those, many of these things were developed to improve access to software or tools or services through an accommodation request. And then someone said, wow, we could actually use this somewhere else. So I love this example. It is a real thing. I've seen it. I've built software with folks as an accommodation that was then used for other things. Like I've just seen it in practice. So I'm a big fan of this accommodation is innovation. If you haven't seen it yet, just give it some time doing the job. Eventually you will. So some of the other examples that we talked about in the Lunch and Learn, the typewriter, if folks don't know, that was built created as an accommodation for a countess in Italy. And we all now use it, but this was originally for a countess who was blind in Italy. SMS text, also emergency alert system to ensure that persons with special needs, vulnerable populations were alerted to emergencies. Someone realized, wait, this is a great tool. Can we live without text today? Maybe. Audiobooks created by the American Federation for the Blind, and it's like the only way that half of America reads now. So these are all examples of where we have identified that an accommodation can turn into a greater innovation for the entire population. So we want to just include that in there, encourage everyone going through the accommodation process. We should go through it with the heart and the mind that we want to solve the problem. But we also need to make sure that we're following what the law says, because that way we're protecting the process for the individual and for our organization and ourselves as well. Thank you.